Mastering Colostomy Care, a comprehensive training guide for medical students. Objective 1. Gather all the required equipments. Objective 2. Encourage clients to look at the stoma. Objective 3. Explain the procedure to the patient. Objective 4. Move the curtains to provide privacy. Objective 5. Perform hand hygiene and wear gloves. Objective 6. Spread Macintosh over draw sheet. Objective 7. Remove used pouch and the skin barrier gently by pushing the skin away from the barrier. Objective 8. Remove the clamp and gently empty the fecal content into bedpan. Objective 9. Discard the disposable stoma pouch in a paper bag or kidney tray after removing it away from the skin. Objective 10. Observe the stoma for color, smell, swelling, trauma, and healing. Objective 11. Stoma should be moist and pink. Objective 12. Cover the stoma with a gauze piece. Objective 13. Clean the peristomal region gently with warm tap water after using gauze pack. Objective 14. Remove gauze and clean stoma with gauze, dry pat it. Objective 15. Measure the stoma by using measuring guide. Objective 16. After taking the measurement from the measuring guide, the measured circle is to be made over the Caraya plate. Objective 17. Apply Caraya powder around the stoma, which will give a skin protection from any skin peel. Objective 18. Apply Caraya powder around the stoma, which will give a skin protection from any skin peel. Objective 19. Paste the Caraya paste or duoderm around the stoma. Objective 20. Take appropriate measurement of the stoma to place the stoma bag without touching the wound. Objective 21. Cut the stoma bag according to the measurement of the stoma, in circular motion. Objective 22. Apply Caraya ointment around the stoma for good adhesiveness. Objective 23. After cutting the stoma bag according to the measurement of the stoma, paste the bag over the stoma by using a Caraya ointment. Objective 24. Ensure that the pouch is closed and sealed before placing it over the stoma. Objective 25. Use the pouch, which is drainable, and secure it by using a clamp or clip, which need to change every alternative day. It is used for a temporary purpose of 4 to 5 days. Another stoma with is attachable to stoma plate can be used for a period of 15 days to 1 month. It should be also washed and cleaned every day past emptying of the drain. Objective 26. Check for proper placement of stoma bag without irritating the stoma lining. Objective 27. Remove the Macintosh. Objective 28. Change the draw sheet if spoilt. Objective 29. Remove the gloves and wash hands. Objective 30. Make the patient comfortable. Objective 31. Clean the area and replace all the articles. Remove the privacy curtains. Objective 32. Record the procedure. Congratulations, you have successfully completed the assignment. Thank you for watching the video.